So in this section, we are going to talking about the prevention and the control of communicable disease. The strategies using for prevention of infectious disease, including prevention measures to strengthen the monitoring and management of infectious disease, the global control of infectious disease. There are many global efforts in controlling the infectious disease that has already been done. For example, in 1980, the elimination of smallpox globally and the polio eradication was launched in 1988, and also in 2001, the launch of TB termination campaign. Several strategies can be used to control infectious disease, including providing the safe drinking water, the foods train, and action take to against the vector of disease to improve the personal hygiene and also to improve the vaccinations. According to the vaccination, I think now is the most valuable and efficient protective measures to control the COVID-19 worldwide. So in the next section, in few slides, I would like to share some our published data. So we did a global survey on COVID-19 vaccine acceptance by different countries. So as we can see, these figures show the 4 options for the COVID-19 vaccine acceptance, including likely, extremely likely, unlikely, and extremely unlikely. So as we can see, the Australia, China, India, in general, has very high willingness rates to uptake the vaccine. However, some countries, they have lower vaccine acceptance willingness in compared to other countries, including Iran, Japan, and the United States of America. Here shows the vaccine acceptance by region. So same, we have 4 options for people to choose: likely, extremely likely, unlikely, and extremely unlikely. So as we can see, European people has very high vaccine acceptance, followed by African. There are many ways to control the reservoir of infection, including to control from the patient, carriers, and susceptible contactors, and also the animal reservoirs. For the patient, we should detect early, diagnosis early, report early, and isolate patients and treat patients from time. For the potential carriers, we should perform screening, physical examination like fever examination to record their symptoms or behaviors. For the susceptible contactors, for example, during COVID-19 in China, we also quarantine those people who are susceptible contactors. For animal reservoirs, we can use sacrifice, vaccination, and isolation. So for sacrifice, for example, during this COVID-19, Denmark government has sacrificed millions of meat animal because it's reported that COVID-19 virus variants, they were detected among this meat. So they were supposed to have the risk to spread the virus to humans. There are also some measures to stop the transmission, for example, the disinfections and the disinfection and the pest control. Some measures to protect the susceptible population. So the most common used measures, for example, is to provide them the immunization. For example, the taking the vaccine, and also can eat some drugs in order to prevent. For example, during this COVID-19 pandemic, many Chinese, they take some Chinese herbals in order to prevent to getting the COVID-19, and also using the protective equipment such as face mask, gloves, and those professional equipment that can be used to prevent the direct contact of the virus. So if the outbreak of epidemic occurs, so which means the epidemic is sort of spread over. So in general, the following approach should be taken during outbreak of epidemic, including like accurate diagnosis, identification of the microbial source cause, confirmation of an epidemic with preliminary surveillance data, and the production of a working hypothesis as to the likely cause, source, and the means of transmission. The intervention aimed to remove the source and interrupt transmission. And finally, the surveillance in order to measure the efforts of actions taken and to indicate any need to modify those actions.